Good afternoon, and thank you so much for joining us for this week's Thursday with AARP show. I am Maber Miller, your host for the weekly show, but also the Associate State Director of Community Outreach. Thank you again for joining us. So as always, a friendly reminder before we get to our guest is to check out the AARP Wisconsin website for information on upcoming events, resources, and also information about the COVID-19 vaccine. Please also remember you can volunteer with us. Even though right now we are not having any in-person events, there are still opportunities to join our volunteer family. You can find additional information and also an online application at the website below. I always like to talk about the AARP Friendly Voice initiative that launched last year. Please remember this is open to all ages and you do not need to be a member of AARP. This initiative is to talk to one of our trained AARP volunteers just to hear a friendly voice on the other end. This could be a phone call that you receive weekly, daily, or monthly, but just know that there's always somebody available to chat with you, and we'd love to hear from you. You can visit the website below or the phone number. You can request this phone call for yourself, or you can request it for a loved one. So you can find additional information below. So if you're not aware, this week is Brain Awareness Week, which is a global campaign to foster public enthusiasm and support for brain science. Today we have with us Dr. Darren Gitleman, who is currently the Senior Medical Director of Advocate Memory Care, Professor of Neurology at Rosalind Franklin University, and Adjunct Associate Professor of Neurology and Radiology at Northwestern. From 2015 to 2020, he was awarded the Connolly Regional Top Doctor in Neurology, has over 90 publications, and has received grant awards from the McDonnell Pew Foundation, the Howard Hughes Medical Institute, the Illinois Department of Public Health, and then also the National Institutes of Health and the Michael J. Fox Foundation. And I'm not doing his bio any justice, so we're very excited to have Dr. Darren Gitleman with us today to talk about brain health. Good morning, or good afternoon, Dr. Gitleman.
Good afternoon. Thanks so much for having me.
Yes.
I really appreciate the very kind introduction.
Yes, absolutely. And like I said, I didn't do it any justice when I was reviewing your bio. I was like in awe that we have you on our show today. So thank you so much for joining us. So as I stated kind of in the introduction, this week is Brain Awareness Week, which is all about the progress that is being done in brain research, as well as progress and diagnosis, treatment, and prevention of disorders. So, Dr. Gitleman, since you are an expert in memory disorders, can you tell us more about what is going on in understanding Alzheimer's disease and also forms of dementia?
Well, thanks so much for asking. And that's what we do here all the time. We're definitely aware of our brains and our patients' brains. And there's a lot going on in the field now. I wish I could say more that there were cures for Alzheimer's disease. There isn't one yet, but on the horizon, there are some treatments. And we've just learned so much more in this year and in recent years about ideas for treatment, about diagnosis, and about factors that may increase or decrease people's risk of having Alzheimer's and other dementias. So there is an application at the FDA for a new treatment, potentially for Alzheimer's disease. May have a mild benefit, and we'll learn more about that in June or so. The FDA is set to approve it by then. There's a blood test now. So much in the past about Alzheimer's disease has been, we rule out other problems. We say a person doesn't have strokes or they don't have a deficiency of B12. Well, maybe they have Alzheimer's. But now the field is turning around so that it's not just a negative diagnosis, but we may be able to say when someone really does have the disease, and just by a simple blood test. There are some other affiliated disorders. We've all heard about football players who have injuries to their brains and develop a chronic form of dementia called chronic traumatic encephalopathy. And there are better descriptions of that have just come out now, and that will facilitate us being able to diagnose people in life. Previously, we could only do it through autopsy, but we'll have a better understanding of who may have that disorder, and that way, better able to do research, better able to identify people who may need our help. Some risk factors for Alzheimer's disease have come up, and some that you wouldn't expect. So air pollution, if you can believe it, may be a risk factor. And how can we deal with that? Well, we need to think about our representatives and how they, what they promote in terms of clean air and helping our health for later. Other things that may be a risk factor for Alzheimer's disease: sleep disorders. So we all know that sleep disorders make us tired, obviously, but people have now shown that problems such as sleep apnea can increase the protein called amyloid in the brain that can lead to Alzheimer's disease. And so that treatment of sleep disorders is really important. And in fact, although in the past 20 years, 150 drug trials have not proven effective in Alzheimer's, in recent years, lifestyle factors, so exercise, diet, such as a Mediterranean diet or the diet out of Russia called the MIND diet, exercising not just your body, but your mind as well, learning a new instrument or learning a language, for example, and getting good sleep may be among the factors that reduce our risk of getting Alzheimer's disease later.
And thank you so much for that. If you are just joining us today, we are talking all about brain health with Dr. Darren Gitleman. If you have any questions, you can post them below on the facebook.com page or our YouTube page, and we will be taking them momentarily. Dr. Gitleman, I have a question before we get to our next one that just kind of came up. Is when people are thinking about brain health, is like dementia or Alzheimer's, is it hereditary? Is that something that maybe people should be concerned about?
So there definitely are hereditary factors, but for Alzheimer's disease, for example, when things are hereditary, they can be dominantly hereditary, meaning that if it's in the family, half the kids are at risk for getting it. That's very rare. So it happens in Alzheimer's disease. There are families with it, but super unusual, less than a few percent of people. At the Advocate Memory Center, we are part of a national group called the Dominantly Inherited Alzheimer's Network Trials Unit, in which we do have those people come in, and we're looking for, because we know they're going to get the disease, looking for treatments, and they unfortunately get it at a young age. But for most people, dominantly inherited is not the issue. There are some risk factors, but just like if you had heart disease in your family, well, you might get heart disease, but maybe you treat your high blood pressure and you don't. And we're learning that maybe we should be thinking about Alzheimer's disease the same way, where there are these risk factors that we can treat earlier in life, and that may help us later. So some risk if it's in the family, but not a guarantee by any means.
And we do have a question from our audience. I'm going to get to that right now. So Dr. Gitleman, a lot of websites tout brain games to keep our brains functioning well later in life. Do those help? And are there any other learning or gaming-based strategies to improve our brain health?
That's a great question. And I guess part of the answer is we don't know yet. So there isn't one brain game that's been shown, like, do this, and if you just, find those items on the screen or come up with words, that's all you have to do. What I tell people is, and my patients, is you really have to think of the life as the brain game, right? So you have to try to, and it's been so hard this year. I was really pleased to hear that AARP has those phone calls just to connect with people, because we're all social, and the isolation has just been so tough on our patients this year. And so I really love that you guys do that. But, being social, getting out, now hopefully we'll be doing that this summer. It's been a year. But as I mentioned before, people learn a new language, learn an instrument. What happens a lot of times with brain games is they're very repetitive, and your brain is super good at figuring out how to do things, and then it becomes no longer a challenge. Mm-hmm. So it'd just be like if you were doing an exercise and you said, well, is this enough? Do I just do curls, Or could I just do a slow walk? Would that be enough exercise? And I would say, well, no, you really have to challenge your body, and you have to challenge your brain too. So brain games are good, but mix it up a little bit. Card games, people play bridge, and do all knitting, gardening, doing all kinds of things is really what we should be doing.
And thank you, Sam, for that question. Dr. Gitleman, can you talk a little bit about some of the warning signs that maybe our viewers should look at if maybe their loved one for like Alzheimer's?
Sure. So a lot of people worry, certainly as they age, that we all notice little slips of the tongue, or we can't come up with a word, or, who hasn't put their keys down and then gone searching for them. So that happens to all of us, but it's intermittent and pretty rare, and it doesn't usually interfere with our daily lives. So the Alzheimer's Association has 10 warning signs for Alzheimer's disease. And really the take-home message is it's when the warning sign interferes with daily life. So for example, memory loss that disrupts daily functioning. So it's not just that you misplace your keys, but you're misplacing things all day. You can't get out of the house because you misplace so many things, or you seriously lose your car more than once, or not just that you turn down the wrong block and you have to reorient yourself, but you have to call people to figure out where you are, or missing many bills, for example, as part of the memory loss. Other things, people who are having trouble solving problems in their daily life, trouble with decision making, confusion about time or place or where they are, problems when looking out into the world, they don't understand images anymore, or there's a distortion of spatial relations, or sometimes people will say they don't see something and it's literally in front of them, and it's not a vision problem, it's that their brain is not seeing. Problems with words, so not just the occasional word that you miss, but really are not able to effectively communicate in speaking or writing, or understand. Misplacing things I've mentioned, but also losing the ability to retrace one's steps to kind of figure out where the item is. Problems with judgment. In this day and age, we have to all be so careful about getting scammed and things like that. But making bad judgments, giving away our, hard-earned money to organizations, more than once, or maybe deserving organizations or things like that. Withdrawal from social activities. Well, it's been hard to tell this year, but if we are not normally engaged with our friends and our family, that's really a problem. And then changes in mood or personality. 100% of people with Alzheimer's have memory problems, right? They have thinking problems, but about 90% also have behavioral problems. And so if there's a marked change, that's a concern as well.
And thank you for sharing that too, Dr. Gitleman. If our viewers are watching this, and once again, I know you stated it's not just once in a while you're losing something, or if you can't problem solve, but when would it be a really good time then maybe to see your doctor if there's a bigger concern about Alzheimer's?
Well, I think anytime memory or other thinking or concerns rise to the level of concerning someone, we all have different levels of concern. Some of us are pretty anxious about stuff, some of us more calm. Certainly, if you're worried about it interfering with your life, and particularly if you're noticing it in a family member, encouraging them to get an evaluation, an initial kind of screen through their primary doctor, kind of captain of the ship, helping patients navigate their medical problems, but then potentially seeing a specialist if the primary doctor can't pick up the problem or more evaluation is needed.
And I know my coworkers, I've mentioned this, my grandma passed away in December at the age of 93, and she did have Alzheimer's as well as her mom did. And because she lived kind of farther away from us, we didn't realize how bad it had gotten until she got into a car accident. And when they asked for her insurance, she couldn't come up with it. So my dad took her to the place and that place went out of business about 5 years prior. So, I do like how you shared with us some, ways that maybe we can identify that there is a problem, because I think I can only speak for myself going through that list. If I'm experiencing that, sometimes it's hard to reach out for help because you maybe don't want to know. What would you tell to somebody who maybe is experiencing this and maybe, kind of scared to reach out for help?
That's so right what you're saying. When they do polls nowadays, I always ask people when I give a talk, what was the disease that your parents feared the most and didn't talk about? And everybody says cancer, right?
Mhm.
And then you say, well, what's the disease that everybody in the audience fears the most? And it's Alzheimer's disease nowadays. And people are reluctant to ask for help. And sometimes, their primary care doctor may be reluctant to sort of label them with that because there's some stigma associated with it. And what are we doing for it anyway? We can't cure it. But first of all, I would emphasize that getting an evaluation, there are many disorders that cause memory problems that are treatable. People can have vitamin deficiencies, changes in their thyroid function, for example, hormonal changes such as thyroid. And those things are really treatable and may return the person to normal. That I certainly see younger individuals, people in their 50s or early 60s. Sometimes they have a sleep disorder. They don't even recognize it. And then when you treat them, they're like, wow, I'm awake during the day and I can concentrate now and there's no longer a memory problem. So first and foremost, getting an evaluation, getting diagnosed may mean, treatment for the problem or at least some mitigation of the symptoms. And then we don't have a cure, but we do have medications that can help a bit. And it allows people to plan out their lives. So sometimes people say they don't want to know, but it's important for them and their family to think about the future. And then finally, some people like to participate in research. And there are new research trials all the time. It's not for everyone, and research is not the same as treatment, but some people really like to feel that they're contributing to future knowledge and to potentially treatments for their family if it is in their family.
Dr. Gitleman, I know we received that really good question from Sam regarding, some stuff that maybe we do online. So what are some other maybe easy to understand strategies to save or improve our brain health that we have not talked about?
Great question. So I'll say part of this is, under intense study now by the Alzheimer's Association and by other groups to learn what are those lifestyle factors. And we now think of Alzheimer's disease and the other dementias not as a disorder of old age. I mean, we're used to thinking, if I said to you, when does Alzheimer's disease strike? You'd say, well, there's 70s, 80s, 90s. And I was sorry to hear about your grandmother, for example. And but it's actually a disease that starts in middle age. So it takes 20 to 25 years for the changes to accumulate in the brain to the point that we're symptomatic. So I always say to people, there's no time like the present to look into changes in their own lifestyle that may make a huge difference later on. So exercise, super important. Exercise that's you build up to. So don't everyone go out and and run a marathon tomorrow.
Correct.
But you want to build up to it to where it's of moderate intensity, so that you're sweating a little bit and breathing a little bit heavy. Eating healthy diet like a Mediterranean or what's called a DASH diet is very popular. It's dietary approaches to systolic hypertension, or the MIND diet out of Rush is an excellent diet. Getting good sleep, we've talked about. Training your brain, so exercising your brain, we've talked about. Stress reduction is important. So all of those things. And this is part of now a large national study called the U.S. Pointer Study, in which we're taking individuals between the ages of 60 and 79 who are interested in trying to improve their brain health. So these are people who are not doing all the exercise, not doing all the things for their brain now, but they're thinking about their future and want to improve how they do. People are coming in and participating in this program where they do exercise, they do the diet, and so on, to try to see if that will make a difference in the long run.
Great. And thank you, Dr. Gitleman. It looks like we have one more question from Sam. So one more question, if I may. Of course, Sam, you may. So Dr. Gitleman mentioned that some therapeutics will provide some improvement. I've seen some TV ads, but hard to know what the meds do. Do those work on advanced dementia or just early onset dementia? And how do we know when to ask about taking a medicine? Very good question.
Great question, Sam. So there are medications. When I've heard of medications, I mean ones approved by the FDA that have been run through extensive clinical trials. There are a number of medicines, one under the group called the cholinesterase inhibitors, and you may have heard of drugs like Aricept, for example, now called donepezil or galantamine or rivastigmine, another drug called Namenda or memantine. These have all been studied now. I mean, unfortunately, we haven't had new drugs in some time. So those drugs date from 2000, actually 1998 or so, to about 2006. So they've been studied for many years. We know of their effects. We know they help a little bit, but we also know they are not a cure. So that's what I'm referring to by drugs. On TV a lot, though, you do see ads for a variety of supplements. Those have not been well studied and have not really shown themselves to be effective in the very limited trials that have been done. So I don't actually recommend supplements for people in general unless they're deficient. So if you're deficient in B12, sure, I'll recommend you take vitamin B12 or vitamin D, for example. But just to take vitamins for vitamin's sake or just to take various supplements, they need to be studied in the proper way. You know, people look at resveratrol or turmeric. Well, maybe those will be effective, but we need to really figure that out with the science.
Dr. Gitleman, I know we're kind of coming up to our end time, so I kind of have a two-part question. One is, of course, our viewers, you know, what resources are out there for additional information about brain health? The second part is we might have viewers who are caregivers to a loved one who is fighting this disease. As one of my really close friends, his dad is the caretaker for his mom, and you know, that's hard to be a caretaker for somebody fighting any disease, but especially this. What resources are out there kind of maybe for some support for them?
So I can't emphasize enough how important it is that you brought that up. So thank you very much. Alzheimer's disease and the related dementias, they don't just affect the patient, right? They affect their family, their caregiver as well. And, you know, and family members devote themselves sometimes to their own medical detriment. And I say to my, you know, caregivers, it won't help the patient if you're sick, right? It has been shown in other studies that if the caregiver is depressed, the patient's more likely to wind up in the ER. So it's so important for caregivers to care for themselves, to make time for themselves, to get help from their family or to hire help that so they can relieve their own stress, that they can exercise, that they can get to sleep. Really, really important. There are resources out there. There may be social workers through your doctor or through the specialist. We have one at the Memory Center. The Alzheimer's Association can develop a care plan for patients and can provide support groups for caregivers usually, and sometimes patients as well. And so there really are a variety of support groups. And you know, not just for Alzheimer's, there are other dementias like Lewy body dementia that has society and support groups, frontal dementias, vascular dementias, and so on. So all of them do have some disease-specific type of support groups, but the Alzheimer's Association, I think, comprehensively, you know, provides the most assistance.
And Dr. Gitleman, I know in the beginning of the show, you kind of planted the seed a little bit on a possible new medication. Could you talk maybe just a little bit more about that?
Yes. So Alzheimer's disease, the main hypothesis for how it gets started is that a protein called amyloid, for reasons we don't always understand, gets deposited in the brain, and that triggers a whole cascade of other changes in the brain. Amyloid forms the plaques that when we hear about plaques and tangles from Alzheimer's disease, amyloid forms those plaques, and the tangles are a different protein called tau that we think gets there, again, through the amyloid. So one strategy has been to try to pull that amyloid out of the brain by using what we call monoclonal antibodies or engineered kind of manufactured antibodies that can pull that out. The early trials, not so effective, but they were done in people who already had a moderate to severe level of dementia. Current trials are people who either aren't demented yet, but are likely to be, or are mildly affected. And the studies suggest that there may be some benefit in slowing down the course of the illness slightly. Again, it won't be the cure yet, but maybe part of a comprehensive strategy to treat patients. That's currently under review by the FDA. One of the trials for this drug, called aducanumab, was positive. One of them more supportive, but not as positive. And so it'll be up to the FDA to kind of review that thoroughly and decide whether that's something to support yet, or if more information is needed.
Great, thank you. So Dr. Gitleman, I must say, we know that it's Brain, of course, Awareness Week, but we appreciate your insight. You are an expert, and for us to have you on our show today has just been really beneficial. So I want to thank you so much, and I bet our viewers feel the same about all the information. And once again, if you feel like you need additional information, you can always go to the Alzheimer's website. So thank you so much for joining us. We appreciate it.
Thank you for joining us. We're at the Advocate Memory Center at Lutheran General Hospital. People can look us up online. The U.S. Pointer study I've mentioned, people can look up online as well. And it's been a pleasure to be part of the conversation.
Thank you. So, and Dr. Gitleman, just to confirm, you're out of Illinois.
I am out of Illinois, but I have a whole set of colleagues up in Wisconsin at Aurora as well, led by Dr. Malone. So they're wonderful.
Great. Thank you so much. We appreciate your time with us today. And before the end of the show, of course, we always like to give some additional updates. So I first would like to start off by saying the Small Dollar Big Impact Grant application will be due April 21st. And if you recall, this is small grants available up to $1,000 for your organization for really fun, creative, and innovative ways that you can impact your community. So all information could be found below at that website. Also, please remember the Challenge Grant. The AARP Community Challenge Grant was launched last month. Applications are due April 14th. This is through our national office. So similar to Small Dollar Big Impact, but on a larger scale. So if you have a really fun, creative idea, ways that you can make an impact in your community, please make sure to check out the website below. There are also a few upcoming events that might be of interest to you. So March 19th, Movies for Grownups. March 23rd, Decluttering and Downsizing. Of course, now that we're home longer, we're starting to look at our place thinking maybe there's ways that we can get rid of items. March 25th through AARP Wisconsin is the Healthy Lifestyle Series, all about stress management. So Dr. Gitleman mentioned, stress, of course, can be stressful on the brain. So please join us then. And then also March 30th is Foods and Elegant Entertaining in the 19th Century. That sounds pretty fancy. So if you're interested in any of those events, you could check out the website below or the 1-877 number. And lastly, for next week's show, we will be talking all about how to drive safely. So all about your checkup list. You might have seen the article in your bulletin this month. So we're going to be joined by Neil McCollum, who's the Volunteer Driver Safety State Director with AARP Wisconsin. So of course, that show is next Thursday at noon. You can join us back here on the Facebook.com page or the YouTube page. I want to thank again Dr. Gitleman for all his information. I definitely encourage you to either take a friend or family or share this video on your Facebook page or YouTube page. Once again, just to get the more information we can get out to people about brain health, the better. So thank you again for joining us today. I look forward to seeing you next Thursday, and stay safe.